Hi, my name is Erin Little. I am the founder of Sucre Blue. We're a nonprofit healthcare organization looking to provide access and affordability um, to treat people with chronic diseases in India. A lot of people don't know what a chronic disease is, but what this means is that it's a disease that requires lifetime management, which means constant doctor appointments, constant costs, and often the complications take your life. This is cancer, this is diabetes, this is cardiovascular disease. A lot of these diseases are preventable, and unfortunately, with over 60 million diabetics and 10 million undiagnosed, India has a major epidemic on their hands, and no one's trying to attack this issue. So, what my organization is trying to do is to teach the average person who maybe has diabetes in their community. And specifically, we're working with female health workers to provide basic diagnostics to villages, low income communities, and places where this really isn't available. These products are not available in India. Um, there's limited access to doctors, limited access to hospitals, and needless to say, we're trying to tackle a huge issue. And just to kind of give you an example of what this means and where your money is going in this campaign, um, this is, I don't know if you can see this, but this is blood glucose testing. So this is a very basic diagnostic that the average diabetic in the US has to do 7 or 8 times a day. So as you can see, there's a little meter that's reading it. I'm not sure if this is going to show up backwards or not, but my blood sugar is 319. That's actually not a good blood sugar reading. I need to do a correction. I need some medicine in order to kind of balance that. But why this is important for a diabetic or someone with a chronic illness is because this is how you have a conversation with your doctor. This is how you have a conversation with yourself, and you can figure out your own self-management of this disease. You're not dependent so much on a doctor. You're not dependent on the infrastructure that's already there. And more or less, this tells me how much medicine I need to take on a daily basis. So from 7 or 8 times a day in the US. And the cost of this, it's 50 cents per strip, plus the cost of this machine, which is about $100. And what we're doing in India is providing door-to-door consultations. We're lowering the cost of these strips for follow-up. We're providing free screenings. And someone doesn't have to purchase this entire unit. So what we're doing is coupling education, prevention of these diseases, and helping the follow-up process. Yes, there's a dog behind me. I don't know what's going on. Providing follow-up for these services to lower the cost and hopefully actually reverse this disease and what it's doing in India right now. But we really need your help. We have the cost down to about $5 for someone to enter our program. But in order to reach 50,000 people, which is our goal of our pilot, I need a lot of help. I'm type 1 diabetic myself. I'm from, I was diagnosed in a rural region where I really understand why it's important to be diagnosed for these diseases, because unfortunately, had I not had access to be life-flighted in a helicopter, I never would have had that opportunity myself. I wouldn't be here today. We are hoping to raise $100,000 and doing this by $5 donations. So your $5 donation goes for the cost of these products, goes for the training that's provided by our clinical partners in order to figure out how to train someone like myself to test blood pressure, test basic diagnostics like this machine does in order to prevent diabetes, hypertension, and cardiovascular disease from destroying these systems in areas where the infrastructure is not set up to support it. So thank you so much for your help, and hopefully you understand a little bit more about what we're trying to do. And if you could share some sugar, we'd really appreciate it. Thanks.